first topic is going to be how to take care of your stitches when you get off the clinic. The second of it is how to take your medicines that you're going to bring back home. And the last bit is the leak test that you're going to do today in a few moments and the one that you're going to do tomorrow morning here at Pompeii. Okay? My name is Pedro. For those who don't know me, I'm a translator here to Pompeii. Nice to meet you. And let's start. Tomorrow morning when the doctor comes to see you to check that everything's good with you and you're going to be good to go to your destinations, either beach house or Holiday Inn, they're going to tell the nurses to disconnect your IV and your drain. The drain is going to leave a hole in your abdomen that is going to close by itself. It's totally normal to continue leaking the next 3 to 5 days. So if your gases got wet, don't freak out about it. You're just going to have to change it for new clean and dry ones. Okay? The stitches are going to come off 10 days after your surgery or 8 days from now. 8 days from now, you're going to go with your local doctor to take them off. In the meanwhile, you can just clean it with soap and water every time you take a shower, as well as the drain hole. And if you want to, you can put a band-aid over the stitches if you don't want it to get tangled with your clothes. If you don't want to, it's okay. Any questions about it? It's really simple, right? You just go 8 days from now to your local doctor to take them off, and the drain hole is gonna close by itself, and it's normal to continue leaking. Okay? The next topic is the medicines. These are the medicines you're gonna take back home. It consists of 2 antacids, 1 antibiotic, 1 painkiller, and something in case you experience diarrhea. Every bag of medicines comes with this. This is your prescription. It's really important for you not to lose this little paper because with this one you're gonna be able to cross your medicines through the border, okay? So just be really careful with it. And the prescriptions is we are on a Mexican clinic. It's in Spanish. So for those who don't speak Spanish, we put a little sticker of every box of every medicine with the Pompeii logo in it. It comes with the name of the medication, for what it's for, when to take it, and what doses to take, okay? So you can follow up the instructions. When you have to start taking your medicines, the only medicine that you're gonna take tomorrow is this one, the Riapan. This is an antacid that comes in little packages with gel, like this one. And what this medication does is to protect your stomach, your esophagus and stomach from your other medicines and from the liquid diet that you're gonna start, okay? To protect you from the Powerade, the broth, the protein shakes, and that kind of stuff, okay? So tomorrow, as soon as you get this patch, you're gonna start with this one, okay? With your first doses of that Riapan. You don't have to mix it with water or anything, you're just gonna take half a package as it is, okay? Every 8 hours for the first week. You take half of the package and then you can start your liquid diet tomorrow, okay? On your second day of the clinic, which is gonna be, well, tomorrow it's Sunday, on Monday, you start with these 2. The Meprazole, your second antacid, and your antibiotic, okay? On Monday morning, you're gonna start your Meprazole with your Riapan in the morning, okay? You're gonna take 1 capsule every 12 hours for 2 weeks, well, for 15 days, okay? 15 minutes later that you take your first doses of Meprazole and Riapan on Monday, you're gonna take your antibiotic. There's someone allergic to penicillin here? No? All good? Perfect. So this antibiotic comes in a little bottle with powder, like this one, that you're just gonna have to fill with water until a little mark on the back of the label over here. You fill it with water, mix it, and you're gonna take 5 milliliters of it. Right here you got the 5 milliliter mark so you don't get lost with it, over here. And you're gonna take those every 12 hours for the first 5 days only, okay? Not the whole week like the Riapan. In the meanwhile, since liquid medication, you can save it on the fridge, okay? Just remember, the Riapan is the only medication that you're gonna take tomorrow. And the day after that, you start with the Meprazole in the morning with the Riapan, and 15 minutes later, you take your antibiotic, okay? And you keep on with the doses that you got scheduled. In case of pain, it's like one of the most common symptoms after the surgery, with your painkiller, ketorolac. Like I told you, this is only in case of pain. If you don't experience it, you don't have to take this medicine at all. But if you do, you take 1 pill every 6 hours as long as you need. And last but not least, we give you this couple of pills called Pyramid. This is just in case of diarrhea. If you go to the bathroom more than 3 times a day, or if your evacuations are really liquid, take 1 pill every 4 hours until it runs out. Okay? If you already finished your medication and you keep on with diarrhea, we recommend you to go to your local doctor if you're already back in the US. Okay? If you're still here in Mexico, we recommend you to give us a call back here so we can check you out. Any questions about your medicines? No? All good? Perfect. Let's continue to the last topic, which is gonna be your leak test. That one's gonna be in another facility called Radio Image. It's gonna be like 15 minutes from here, depends on traffic. You're gonna go there, they're gonna register you. You're gonna wait like 15 minutes, and they're gonna call you one by one to take you to the leak test. The leak test is called the bar and swallow test. It's our strongest leak test, and it consists of you drinking a contrast called a barium. That's gonna paint your esophagus and stomach, and they're gonna take an X-ray picture of it to see if there's any leak. Okay? The process doesn't take much longer than 5 minutes. It's really quick. You just drink the contrast, and they're gonna take a picture of it. Okay? As soon as you all finish, you're gonna wait like 20 minutes for the results. Those results that they're gonna give you are for you to keep. Okay? You can take those back home. They're gonna send a digital photo of the X-rays to the doctor so they can check it back home here. Okay? After that, you're gonna come back here to the clinic so we can reconnect you again. Okay? Just heads up, the contrast doesn't taste really good. It's kind of bitter. And 1 out of 20 patients may experience diarrhea. So if you got any of those symptoms, just let us know so we can put you something here. Okay? And the last is the purple drink test that you're gonna do tomorrow. That one's gonna be here in Pompeii. You're gonna drink just apple juice with purple coloring. It's gonna be around 6 in the morning or so. And you're gonna drink that cup. And like a couple of hours more, the doctor's gonna come by to check your drain. If your drain is not purple, it means you're leaking, okay? And after that, they're gonna tell you to go to your destinations, okay? Either beaches or holiday. Any questions? No? Perfect. In a few moments, Abby's gonna take you to the leak test, okay? Thank you very much for your attention, and good luck.
Thank you.
You can get as many popsicles as you want as you get back, okay?
Thank you.
Okay.